Question 1. A patient is seen for a scheduled injection. During the visit, the patient complains of a new, persistent cough, which the physician evaluates and documents thoroughly before administering the scheduled injection. Which CPT modifier should be appended to the evaluation and management E/M code? A. -24. B. -25. C. -57. D. -59. Answer: B. -25. This question tests the correct use of CPT modifiers, specifically for services provided on the same day as a procedure. The keywords are new, persistent cough, and evaluates and documents thoroughly, which signal a service beyond the routine work of the injection. Modifier -25 indicates a significant, separately identifiable evaluation and management E/M service was performed by the same physician on the same day as a minor procedure. For example, if a patient has an appointment for a flu shot but also needs the doctor to examine an unrelated, new health problem, the E/M service for that new problem gets the -25 modifier. Remember, if the E/M service is separate from the reason for the procedure, think -25. Question 2. According to the ICD-10-CM official guidelines, what is the definition of a principal diagnosis in the inpatient setting? A. The most severe condition the patient has. B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. C. The first diagnosis listed on the admission record by the admitting physician. D. Any condition that requires active treatment during the hospital stay. Answer: B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. This question focuses on the core concept of the principal diagnosis, which is crucial for correct inpatient coding and billing. The keyword phrase "after study" is the most important clue, as it differentiates the final diagnosis from preliminary or admitting diagnoses. The principal diagnosis is the ultimate reason the patient required admission. For instance, a patient admitted with abdominal pain, a symptom, who is then diagnosed with acute appendicitis would have acute appendicitis coded as the principal diagnosis. Always remember that the principal diagnosis is determined at the end of the workup, not at the beginning. Question 3. What is the purpose of the placeholder character X in ICD-10-CM coding? A. To indicate that a code is for an external cause of injury. B. To allow for future expansion of a code category. C. To fill empty character positions when a seventh character is required but fewer than 6 characters exist. D. To signify that a code is unspecified. Answer: C. To fill empty character positions when a 7th character is required but fewer than 6 characters exist. This question tests your knowledge of ICD-10-CM code structure and conventions, specifically the use of the placeholder X. The key concept is that some codes require a 7th character to provide more specific information, like the encounter type for an injury, but the base code might only have 4 or 5 characters. The X acts as a dummy placeholder to ensure the 7th character is in the correct position. For example, the code for a toxic effect of an accidental overdose of aspirin is T39.011_, which requires a 7th character for the encounter type, e.g., A for initial. If the base code was only T39, you would write T39.xxxa. Think of the X as a seat filler that holds the spot for the important 7th character. Question 4. In medical coding, what does the term medical necessity refer to? A. Services that are convenient for the patient and provider. B. The process of obtaining prior authorization from an insurance company. C. Services or supplies that are appropriate and needed for the diagnosis or treatment of a medical condition. D. The most expensive treatment option available for a patient's condition. Answer C. Services or supplies that are appropriate and needed for the diagnosis or treatment of a medical condition. This question assesses your understanding of a fundamental concept in billing and compliance, medical necessity. The keywords are appropriate and needed, which link a service directly to the patient's documented diagnosis. For a service to be covered by insurance, it must be considered medically necessary, meaning it aligns with accepted standards of medical practice for the specific illness or injury being treated. For instance, ordering an MRI for a headache would only be medically necessary if symptoms like neurological changes were documented to justify the advanced imaging. A good rule of thumb is to ask, does the documentation clearly support the need for this service to treat this diagnosis? Question 5. A patient is diagnosed with type 2 diabetes with an associated chronic kidney disease, CKD, stage 3. How should this be coded in ICD-10-CM? A. Code the CKD first, followed by the diabetes code. B. Use one combination code that captures both conditions. C. Code the diabetes and the CKD as two separate, unrelated codes. D. Query the physician to determine which condition is more severe. Answer B. Use one combination code that captures both conditions. This question tests the guideline for coding combination codes, which is a common scenario in ICD-10-CM. The keyword is with, which often indicates a causal relationship between two conditions in the ICD-10-CM alphabetic index. ICD-10-CM provides specific combination codes for diabetes with common manifestations, such as E11.22, type 2 diabetes mellitus with diabetic chronic kidney disease, to capture the relationship in a single code. This is more precise than using two separate codes, as it fully describes the patient's condition. Always check the alphabetic index for terms like diabetes with, to see if a single, more comprehensive combination code is available. Question 6. The global surgical package for a major procedure typically includes A. Only the surgical procedure itself. B. The procedure, the initial consultation, and all follow-up visits for 1 year. C. The preoperative care, the procedure itself, and normal, uncomplicated postoperative care for a specific period, e.g., 90 days. D. The cost of the operating room, anesthesia, and the surgeon's fee. Answer C. The preoperative care, the procedure itself, and normal, uncomplicated postoperative care for a specific period, e.g., 90 days. This question evaluates your understanding of reimbursement concepts, specifically the global surgical package. The key phrase, normal, uncomplicated postoperative care, highlights that routine follow-up related to the surgery is bundled into the payment for the procedure. The global package simplifies billing by combining the work immediately before, during, and after a surgery into a single CPT code with a 0, 10, or 90-day follow-up period. For example, removing stitches or checking the incision site after a major surgery is included and not billed separately. Remember that the global package covers expected follow-up. Care for a new problem or complication would be billed separately. Question 7. What is the primary purpose of a physician query? A. To question a physician's medical judgment. B. To obtain clarification or additional information to ensure accurate and specific coding. C. To report a physician for non-compliance with billing rules. D. To suggest a more profitable diagnosis for billing purposes. Answer B. To obtain clarification or additional information to ensure accurate and specific coding. This question tests your knowledge of data quality and coder-physician communication. The keywords clarification and accurate and specific coding point to the compliant and ethical purpose of a query. A coder initiates a query when the medical record documentation is conflicting, ambiguous, or incomplete, preventing the assignment of the most precise code. For instance, If a doctor documents renal failure without specifying if it's acute or chronic, a coder would send a query to ask for that clarification, which significantly impacts code assignment and data quality. The key is that a query should never lead the physician to a specific answer or question their medical expertise. It is simply a tool for better documentation. Question 8. In HCPCS Level 2, which group of codes is used to identify drugs administered by a healthcare professional? A. E codes. B. L codes. C. J codes. D. G codes. Answer: C. J codes. This question assesses knowledge of HCPCS Level 2 codes, which are used to report supplies, drugs, and services not found in the CPT codebook. The key concept is recognizing the different letters assigned to specific categories of items. J codes are used specifically for drugs that are typically injected or infused and cannot be self-administered by the patient, such as chemotherapy drugs given in a clinic. For example, a clinic administering an antibiotic injection would report the appropriate J code to bill for the drug itself, in addition to a CPT code for the administration. A simple way to remember is J is for juice, a slang term for drugs, or more professionally, J is for injection. Question 9. An excludes one note in the ICD-10-CM tabular list means: A. The two conditions are related and can be coded together. B. The excluded code should be coded first if present. C. The two conditions cannot be coded together under any circumstances. D. The excluded code is a less severe form of the primary code. Answer: C. The two conditions cannot be coded together under any circumstances. This question tests a critical ICD-10-CM coding convention that excludes one note, which is vital for coding accuracy. The one in excludes one should signal that you can only pick one of the two conditions because they are mutually exclusive. This note is used when two conditions cannot occur together, such as a congenital form versus an acquired form of the same condition. For example, code category G40, epilepsy, has an excludes one note for seizures, R56.9, meaning you would not report both for the same episode of care. You code the more specific diagnosis of epilepsy. Remember this tip: excludes one means not coded here. The two conditions are mutually exclusive. Question 10. What is the role of a clearinghouse in the medical billing process? A. To provide medical care to patients without insurance. B. To set the fee schedules for medical services. C. To check claims for errors, format them to payer specifications, and transmit them electronically. D. To resolve billing disputes between patients and providers. Answer: C. To check claims for errors, format them to payer specifications, and transmit them electronically. This question covers the revenue cycle and the function of key entities within it. The core concept is that a clearinghouse acts as a middleman between the healthcare provider and the insurance payer. Its main job is to scrub claims, which means running them through software to check for common formatting errors or missing information before sending them to the insurer. This process reduces the number of denied claims, speeding up reimbursement. Think of a clearinghouse as a post office for medical claims that not only delivers the mail but also proofreads the address and adds the right postage first. Question 11. Which organization is responsible for publishing and maintaining the CPT code set? A. The Centers for Medicare and Medicaid Services, CMS. B. The World Health Organization, WHO. C. The American Medical Association, AMA. D. The American Health Information Management Association, AHIMA. Answer: C. The American Medical Association, AMA. This question tests your knowledge of the governing bodies in medical coding. The key is to correctly associate each code set with its publishing organization. The American Medical Association, AMA, develops, publishes, and maintains the current procedural terminology, CPT, code set, which is used to report medical, surgical, and diagnostic procedures and services. While CMS uses CPT for Medicare billing, the AMA holds the copyright and is the definitive source for all CPT codes and guidelines. A good way to remember this is that CPT codes describe what physicians do, and the AMA is the largest association of physicians. Question 12. A patient is admitted to the hospital for acute cholecystitis. The patient also has a known history of hypertension and hypothyroidism, which are managed with daily medication. In this inpatient scenario, the hypertension and hypothyroidism are considered: A. The principal diagnosis. B. Comorbidities. C. Sequelae. D. Irrelevant and should not be coded. Answer: B. Comorbidities. This question tests the concept of secondary diagnoses, specifically comorbidities, in an inpatient setting. The keywords are history of, managed with daily medication, and the fact that they are present alongside the reason for admission, acute cholecystitis. A comorbidity is a pre-existing condition that affects patient care by requiring clinical evaluation, therapeutic treatment, or increased nursing care. Since the hypertension and hypothyroidism require ongoing management during the hospital stay, they must be coded as secondary diagnoses to create a complete picture of the patient's health status. Always remember to code all conditions that are actively monitored, evaluated, or treated during an encounter. Question 13. Which part of Medicare provides coverage for physician services, outpatient hospital services, and durable medical equipment? A. Part A. B. Part B. C. Part C. D. Part D. Answer: B. Part B. This question assesses your understanding of the different parts of the Medicare program, a crucial topic for billing and reimbursement. The key is to differentiate what each part covers. Medicare Part B is often called medical insurance and covers most outpatient care, including doctor's visits, preventive services, lab tests, and durable medical equipment, like walkers or wheelchairs. In contrast, Part A covers inpatient hospital stays, Part C refers to Medicare Advantage plans offered by private companies, and Part D covers prescription drugs. A simple way to remember is Part A is for admission, inpatient, and Part B is for bills from the doctor, outpatient. Question 14. When a definitive diagnosis has not been established by the end of an outpatient encounter, the coder should: A. Code the diagnosis documented as probable or likely. B. Code the signs and symptoms that led to the visit. C. Assign a code for an unspecified condition. D. Wait to code the encounter until a definitive diagnosis is made. Answer: B. Code the signs and symptoms that led to the visit. This question tests a critical coding guideline that differs between inpatient and outpatient settings. The keywords definitive diagnosis has not been established and outpatient encounter are essential clues. Unlike inpatient coding, in the outpatient setting, you cannot code uncertain diagnoses, like probable or suspected. Instead, you must code the signs, symptoms, or abnormal findings that are documented as the reason for the encounter. For example, if a patient presents with a cough and fever and the doctor documents probable pneumonia, you would code for the cough and fever, not the pneumonia. Question 15. The suffix itis in a medical term refers to: A. Surgical removal. B. A tumor or mass. C. Inflammation. D. A visual examination. Answer: C. Inflammation. This question tests basic medical terminology, which is the foundation of understanding clinical documentation. Suffixes provide meaning about a condition, process, or procedure, and itis is one of the most common ones. It consistently means inflammation. For example, a Appendicitis is inflammation of the appendix, arthritis is inflammation of a joint, and dermatitis is inflammation of the skin. Knowing common suffixes like this is a shortcut to deciphering complex medical terms. Question 16. What is the main purpose of an Advanced Beneficiary Notice of Non-Coverage, ABN? A. To inform a Medicare beneficiary that a service or item may not be covered and that they will be financially responsible. B. To get pre-authorization from Medicare for a major surgical procedure. C. To document a patient's refusal of recommended medical treatment. D. To provide patients with a detailed estimate of all their healthcare costs for the year. Answer: A. To inform a Medicare beneficiary that a service or item may not be covered and that they will be financially responsible. This question assesses knowledge of a key Medicare compliance document, the ABN. The keywords are Notice of Non-Coverage and Financially Responsible. An ABN is a form given to a Medicare patient before a service is rendered when the provider believes Medicare will likely deny payment because it is not considered medically necessary. By signing the ABN, the patient acknowledges they have been informed and agree to pay for the service out of pocket if Medicare denies the claim. This protects the provider from non-payment and allows the patient to make an informed decision about their care. Question 17. The Health Insurance Portability and Accountability Act, HIPAA, provides federal protections for A. Provider reimbursement rates. B. Hospital accreditation standards. C. Protected health information, PHI. D. The quality of medical care. Answer: C. Protected health information, PHI. This question tests your understanding of the primary purpose of HIPAA, a critical law governing healthcare information. The core concept of HIPAA's privacy rule is the safeguarding of protected health information, PHI, which includes any individually identifiable health information like names, diagnoses, or medical record numbers. The law sets standards for who can access and share this information to protect patient privacy. Think of HIPAA as the privacy police for your health records, ensuring they are kept confidential and secure. Question 18. Modifier -59 is used to indicate that a procedure or service was A. A staged or related procedure by the same physician during the postoperative period. B. Performed by a different physician. C. A distinct procedural service, separate from other services performed on the same day. D. An unusual procedure that required significantly more work than typical. Answer: C. A distinct procedural service, separate from other services performed on the same day. This question tests the appropriate use of modifier -59, one of the most frequently used and audited modifiers. The keyword is distinct, which means the service was independent from other services performed at the same session. It is used to bypass a payment edit when two procedures are normally bundled but were, in this specific case, performed on a different anatomical site, in a separate patient encounter, or for a different injury. For example, a surgeon might remove a lesion from the arm and another unrelated lesion from the leg during the same visit. Modifier -59 would be appended to the second procedure code to show it was a separate site. Always remember, use -59 as a last resort when no other modifier more accurately describes the situation. Question 19. A patient is seen for a painful right great toe. After examination, the physician documents a final diagnosis of ingrown toenail. In the ICD-10-CM alphabetic index, the main term to look up would be A. Painful. B. Toe. C. Great. D. Ingrown. Answer: D. Ingrown. This question tests your ability to identify the correct main term in the ICD-10-CM alphabetic index, a fundamental coding skill. The main term is typically the disease, condition, or injury, not an anatomical site or an adjective. In the diagnosis ingrown toenail, the condition itself is ingrown, while toenail is a subterm that further specifies the location. Looking up painful or toe would lead you through unnecessary steps or to less specific codes. To code efficiently, always start by identifying the primary pathological condition in the diagnostic statement. Question 20. Which claim form is used to bill for services provided by physicians and other non-institutional providers? A. UB04. B. CMS 1450. C. CMS 1500. D. ABN. Answer: C. CMS 1500. This question assesses your knowledge of the standard forms used in medical billing, a key part of the revenue cycle. The keyword is physicians, which signals professional services rather than facility charges. The CMS 1500 form is the standard paper claim form used by professionals like doctors, physician assistants, and therapists to bill insurance carriers for their services. In contrast, the UB04, also known as the CMS 1450, is the standard form used by institutional facilities, such as hospitals and skilled nursing facilities, to bill for their charges. Think 1500 for the professional and UB04 for the building. Question 21. What is the primary purpose of ICD-10-CMZ codes? A. To report injuries, poisonings, and other consequences of external causes. B. To describe problems related to the patient's socioeconomic and psychosocial circumstances. C. To report factors influencing health status and contact with health services when there is no current illness or injury. D. To identify the place where an external cause event occurred. Answer: C. To report factors influencing health status and contact with health services when there is no current illness or injury. This question tests your knowledge of a specific chapter in ICD-10-CM, the Z codes. The key concept is that Z codes are used to describe encounters for reasons other than a current sickness or injury. This includes situations like annual checkups, screening tests, or a history of a disease that is no longer present but affects health status. For example, a patient coming in only for a routine annual physical would be assigned a Z code, as would a patient with a family history of breast cancer who is receiving a screening mammogram. Remember, Z codes answer the question of why is the patient here today, when the answer isn't a current illness. Question 22. Coding for a late effect, or sequela, in ICD-10-CM generally requires two codes. In what order should they be sequenced? A. The sequela code is sequenced first, followed by the code for the original condition that caused it. B. The original injury code is sequenced first, followed by the code for the current condition. C. The codes should be sequenced based on which one is more severe. D. Only the code for the current condition, the sequela, is reported. Answer: A. The sequela code is sequenced first, followed by the code for the original condition that caused it. This question tests the official coding guideline for sequelae, also known as late effects. A sequela is a residual condition that remains after the acute phase of an illness or injury has terminated. The key sequencing rule is to code the condition that exists today first, followed by the code for the past condition that caused it, often with a seventh character S, for sequela, appended to the injury code. For instance, if a patient has a scar on their face resulting from a burn they suffered last year, you would code the scar first, followed by the burn code with an S. Think code what's here now, then code what caused it. Question 23. Deliberately billing for a more expensive service than what was actually performed is an example of A. Upcoding. B. Unbundling. C. A query. D. A reasonable charge. Answer: A. Upcoding. This question assesses your understanding of healthcare fraud and abuse, which is a critical compliance topic. The keyword is more expensive service, which points directly to the definition of upcoding. Upcoding is the illegal practice of assigning a CPT or ICD-10-CM code that represents a higher level of service or a more severe diagnosis than is supported by the medical documentation, with the intention of receiving higher reimbursement. For example, billing for a comprehensive office visit when only a brief, problem-focused visit was performed is a classic case of upcoding. Always remember that codes must be based strictly on what is documented, not on potential reimbursement. Question 24. What are the three key components used to select a level for an evaluation and management E/M service? A. Time, risk, and number of diagnoses. B. History, examination, and medical decision-making, MDM. C. Patient's age, severity of problem, and location of service. D. New versus established patient, counseling, and coordination of care. Answer: B. History, examination, and medical decision-making, MDM. This question tests your knowledge of the fundamental building blocks of evaluation and management, E/M, coding under the 1995/1997 guidelines, which are still relevant concepts. The key to leveling an E/M visit is assessing the three key components: the extent of the patient's history taken, the complexity of the physical examination performed, and the difficulty of the medical decision-making, MDM, involved. For example, a simple bug bite would require a less extensive history, exam, and MDM than a new patient presenting with multiple chronic conditions and acute chest pain. While 2021/2023 guidelines for office visits now focus on MDM or time, understanding these three original components is essential for coding in other settings and for a solid foundational knowledge. Question 25. The medical directional term proximal refers to a body part that is A. Closer to the front of the body. B. Further away from the point of attachment to the trunk. C. Closer to the point of attachment to the trunk. D. Lying flat on the back. Answer: C. Closer to the point of attachment to the trunk. This question tests foundational knowledge of anatomy and medical terminology, specifically directional terms. The key is to understand that proximal and distal describe the position of limbs in relation to the main body, or trunk. Proximal means situated nearer to the center of the body or the point of attachment. For example, the elbow is proximal to the wrist because it is closer to the shoulder, which is the point of attachment. A helpful tip is to remember that proximal is in proximity to the trunk of the body.